Everybody, good afternoon and welcome once again to a weekly media briefing and public health update with Montgomery County Executive Mark Elrich. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. And joining us today is Dr. James Bridgers, who is the Acting Health Officer, as well as Dr. Earl Stoddard, who is the Assistant Chief Administrative Officer. Joining us as well is Ms. Kimberly Townsend, who is a Senior Administrator for Communicable Disease and Epidemiology for the Department of Health and Human Services. Sean O'Donnell from the Department of Health will join us momentarily. And a special guest today is Dr. Gilberto Zelaya from the Board of Elections. Reporters, when the Q&A portion of this presentation begins, do remember to use the chat to request your permission to ask questions. And with that, good afternoon to you, Mr. County Executive.
So good afternoon, and thank everybody for joining us today. It's hard to believe that Election Day is a little more than a month away. It doesn't seem like there's been appropriate space. Recently, we got some good news that I think will make this general election run more smoothly. Last week, Montgomery County Circuit Court judge ruled to allow the Board of Elections to start processing of the mail-in ballots ahead of the election day. And as you know, during the primary, the governor vetoed a bill that would have allowed it, and votes were not processed. You know, the mail-ins were not processed until days after the election was over, and it led to a huge backlog since many of our residents used the mail-in ballots, and it really complicated and prolonged the counting process. Now we'll be able to start doing the mailing ballots early, and that's going to be good. It's going to be good news for voters and candidates, and it's going to prevent the long delays that we had in reporting final election results after the primary. And it's going to ensure that newly elected officials will be able to be sworn in on time. This decision changes the ballot counting process used this summer when the Board of Elections had to wait 48 hours after Election Day. As a result, the Board of Elections was swamped, and it took weeks to tally the votes. The General Assembly had passed a law this session that would have corrected that. Unfortunately, the governor vetoed it. But fortunately, we're in a better place right now. So thank you to the court for being reasonable. On a bit of unfortunate news, the Republican nominee for governor, Mr. Cox, has a different view. And yesterday he announced that he was filing a lawsuit designed to reverse the court's decision and have once again our election workers counting ballots for weeks after Election Day. It's my hope the courts will uphold this week's ruling, and I do believe the decision is better for Maryland. And I just want to point out, nothing is gained by delaying it. Whether you process before the election or you process after the election, you do the very same things. And all you do is accomplish delaying the results of the election by counting after the election. And I honestly don't understand. There's not a public purpose served by this. And I think that, you know, when residents have to wait weeks for votes to be counted, it's really demoralizing. I think it undermines the confidence that people have in the election process. And I think this country doesn't need any more undermining of confidence in the election process. Today with us, we have Dr. Gilberto Zelaya, and he's with the Montgomery County Board of Elections, and he's here to talk about the impact of the latest court ruling. So I'm going to turn this over to him briefly and let him talk and answer questions, I guess.
Okay, thank you so much, County Executive. Really appreciate the time and the opportunity to engage individuals today. We're going to go briefly and talk, high level on certain talking points regarding the current general election for 2022. Regarding the court relief or yesterday's appeal, at the end of the day, the opportunity to serve our voters better, it's the goal. So depending on what occurs right now, our team, we are planning for the mailing canvas. We have obviously two plans, after October 1st or on Thursday, November 10th. So depending on what comes out with the litigation, we will move forward, and we have no comment on the pending litigation right now. Moving forward, we do request individuals, once they receive the mail-in ballot, to ensure that you return that ballot as soon as possible. Don't hold on to those ballots, don't procrastinate. The sooner we get them at the Board of Elections, the sooner we could do our due diligence to check them in as received, sort, and get prepped for canvass. As of yesterday, the 27th of September, we have received about 119,000 mail-in ballot requests. By week's end, the Maryland State Board of Elections will mail out approximately 97,800 mail-in ballots. Last weekend, the military overseas ballot have gone out. So the goal is that we will receive the vast majority. Compared in 2022 primary, we had a 65% return rate. So nonetheless, depending on the litigation, we are here to serve. Out of the 119,000 mail-in ballot requests, about 17,900 are the web delivery, the infamous web delivery mail-in ballot. We do request voters. If you did request a mail delivery, it's understandable if you are doing research on Mount Kilimanjaro to request the web delivery. But if you're in Montgomery County or you're a domestic voter within the 50 states of our union, we do request that you change that to the traditional card stock, because it will remove the administrative burden on our staff and our poll workers to duplicate those web delivery ballot. The deadline to request the web delivery, the mail-in ballot is November 1st. And the easiest way to make this request is texting the 3 letters VBM to 77788. And in Spanish, those letters are VPC, which means vote por correo. The ballot drop boxes, we're going to move to ballot drop boxes now. They are actually being installed today and tomorrow. The goal is by tomorrow, close of business, we will have the 55 Montgomery County ballot drop boxes installed and ready to receive ballots. Of course, the majority of the mail-in ballots will go out by this weekend, so they will be ready for the electorate to return their corresponding ballots back to the Board of Elections. To identify the closest ballot drop box, you could text the word box and your zip code to 77788, and the corresponding command in Spanish is buzón y su código postal al 77788. I'm going to go really quick now. Early voting, as you know, early voting will take place from Thursday, October 27th through Thursday, November 3rd. We have 14 approved early voting locations. All that information is on our website. They'll be open from 7 a.m. to 8 p.m. If you requested to vote by mail, you will need to submit that accordingly. But if you decide to vote in person, you will need to vote a provisional ballot. For the closest early voting center, as we near early voting on the 27th of October, you could text the letters EV plus your zip code for the nearest early voting center, driving directions, and wait time. And the corresponding Spanish command, SMS texting command, is VA y su código postal al 77788. Now, moving along to poll workers, we need poll workers. Without our civic-minded election heroes, we cannot serve adequately our voters deciding to vote in person. You need to be a U.S. citizen, registered to vote, and live in Maryland. Individuals can earn a stipend up to $1,830, but of course, depending on how many days and what position we will train you to serve. So we're very flexible. We have part-time and full-time election day early voting positions. Training is very accessible. And for those students, you can earn up to 65 student service learning credits or up to a stipend of 630. Obviously, you cannot miss school to serve during early voting. So you have access to serve that weekend or on election day. We do close schools Monday and Tuesday to facilitate voting in those facilities. The easiest way to apply is text the word serve to 77788. And in Espanol es servir al 77788. And we do need Spanish-speaking poll workers. It's required by Section 203 of the 1975 Voter Rights Act, but we do embrace the diversity of the county. So individuals who speak Amharic, Mandarin, Cantonese, Korean, and all of the beautiful languages in the county, we welcome those individuals as well to serve as poll workers. And we do have the Future Vote Initiative. We are the only county in America that incorporates students as young as 6th grade in the election process. And the premise of the program is when they are of age, they could serve as poll workers. Both the poll worker deadline to apply, the Future Vote deadline to apply, And also the voter registration deadline to apply is October 18th. And to register to vote, all you need to do is text the word vote to 77788. Y la palabra en español es vota al 77788. And lastly, election day is Tuesday, November 8th. Make sure that you go to the appropriate polling place. Unlike early voting, you're not tied to the closest or nearest early voting center to your residential address. But on election day, you should go to your corresponding polling place. That will appear on your sample ballot. But to identify the appropriate location, you could text the word check to 77788, and you could update your voter registration as we speak. And in Spanish, la palabra es revise al 77788. So thank you so much. I know it's a lot of information, but everything is on our website.
Thank you.
Thank you. Just a second here. My apologies. I couldn't find my mouse on the screen. Questions, members of the media, for Dr. Zelaya at this point of the presentation before we move forward with a public health update. I'll give you a couple of seconds. Any questions, reporters, regarding elections, the upcoming general election in November? Going once? Going twice? I guess not. Thank you, Dr. Zelaya, for joining us today and all of that information. We'll see you again soon. And thank you.
Thank you so much. Take care, everyone. Stay safe.
We can move forward, Mr. County Executive, with a public health update.
Okay, so we're going to go next to, this is National Energy Awareness Month. And with October just a few days away, I want to put Energy Action Month on everybody's radar. Next week, our Department of Environmental Protection and I will be encouraging residents to be more energy conscious. The goal is to reduce the use of carbon-based energy and begin to adopt alternative energy sources like electricity generated from solar and wind. Throughout the month of October, we're going to be leading the public push for people to make decisions about different ways they can power their lives. And next week is going to be Electrified Your Ride Week. Following week will be Electrify Your Home. And the week after that will be Electrify Your Kitchen. And then we're going to wrap up the month with Electrify Your Lawn. I have myself, I now have solar panels on my house. I've got an electric car. I'm contemplating changes to my appliance setup so I can take the next step in this process myself. And we're hoping that, that everybody plays their part in getting us away from fossil fuels so we can deal with climate change. We've got another reminder of climate change. We get reminders every day, but we're getting these unusual storms with greater intensity. And we've got parts of the country in a deep drought. We have parts of the country getting flooded. We're in unprecedented times in terms of weather, and weather is being driven, by climate here and everywhere else, not an exception here. And we just need to understand that, government cannot solve this by itself. I can't buy your car. I can electrify the government fleet, but I can't electrify the public fleet. So we need people participating in this effort to move us toward a cleaner environment and reduce greenhouse gases. I know that interest and enthusiasm about electric vehicles is really beginning to grow. There are now more than 16,000 plug-in vehicles in the county, and more than half of them are actually fully electric. I've kind of followed the news and prices, and I'll point out there are actually electric vehicles that have gone under $30,000. There are electric vehicles that are close to $20,000 after the tax credits. And so there is a real change from vehicles that normally had been priced above $40,000. The prices really are beginning to come down, and it's beginning to make a lot more sense. I have no doubt that the demand is actually going to grow here, and this should help us achieve our climate goals. Just last month, we got an important update on our climate efforts through the Climate Action Annual Report. By the end of the calendar year, we're going to have 76 projects in the works tied to the Capital Area Solar Co-op, where residents can get discounted pricing and quality installation. 76 projects this year, more than we've ever been able to do. Most Montgomery County rooftops could actually take solar. So it's a good time to be reaching out. The federal subsidies on solar have never been higher. So there are lots of reasons to do this. And I hope people will begin to continue. And I think in the coming weeks, I'll post my electric bill so people can see what's happened in real time in terms of my own electrical use. The county's Green Bank has more money available to help businesses reduce their carbon footprint. And this later this month, the county is going to cut a ribbon on our bus depot that's equipped with a solar panel canopy, which will be the source of power for new electric buses. It's actually part of a microgrid there. And so we've got the canopy, we've got the microgrid, it's able to operate. If Pepco goes down, we have enough battery storage to do the charging in the absence of Pepco. So lots of good news, and we'll be working during October to help raise awareness about all these things. Also in the news is the hurricane. Hurricane Ian is churning its way into Florida right now. They're talking about storm surges along the coast of about 10 feet. That's not a small thing. And earlier I saw a map someone shared of where the storm surge will be and where water will be on that side of Florida when this hurricane is fully fully on the mainland. And it is amazing how much land is either going to be underwater to varying degrees. It was kind of shocking to see where this could possibly lead. We have our Maryland Task Force 1 return to their mission from their mission in Puerto Rico this Sunday. I want to thank them for what they did. We will have some people, I believe, going to Florida for this. And with Ian approaching Category 5 strength, the task force received a request for deployment this morning, and they're going to be staging in South Carolina in preparation for a targeted response to the storm impacts. Once the hurricane passes through Florida, its remnants could lead to widespread rain across the South and potentially impact our region over the coming days. So please stay up to date on the weather and be aware for any watches and warnings. And you can do that by signing up for Alert Montgomery. And it can help you keep you updated on flooding and thunderstorm threats and tornado threats and all the other things that we try to give people a heads up on. This month, from I think it's September 16th to October 16th is our Hispanic Heritage Month. And we've been doing a tour of businesses that we started last week, and we continued this week with a trip up I-270. The first stop we went to was a new art gallery in Bethesda in the Kentlands. It's the second space opened by two women behind Rofa and Beta Galleries. The original location, La Morada in Potomac, is also open to the public, but by appointment only. This is actually street side in the Kentlands. Then the women behind these galleries are proud of the Latin American artists they've been showcasing, and it is really some very nice art there. And I was impressed by the political protest art from the streets of Columbia featured at the new Kentlands location. It's on Main Street in Germantown, and it was great to see people curious about the art inside and browsing when I was there last Friday. And Gabriela Rosso has many stories to share, can talk to you about the art, what it means, and I wish her great success in bringing 20 years of art world experience and a love for daring art to Montgomery County. Next, I traveled to Germantown to a more interactive art experience. We Art Fun is located just a few blocks from the Black Rock Center for the Arts, and it was started by Roxana Rojas Luzon, who enjoyed the paint your own ceramic store in other parts of the county and wanted to bring that experience to the Up County. And in her store, I saw people painting small mementos for their homes and children, working on things to hang on the wall. And it's just wonderful to see these small business owners realizing their dreams and having an impact on the community. And everybody I talked to, you know, their vision includes not just I wanted to open a business, I wanted to open a business that would be welcome and have an impact on the community, and they're definitely doing that. And we're sharing pictures from all of our visits on the Facebook and Twitter pages, and they're also available on the county's Flickr page if you want to look at some of the art and work that's being done. before I get into COVID-19 and monkeypox, I want to talk a bit about flu shots. That's obviously me getting a flu shot. She was really good. I'll say parenthetically, I didn't realize that I was getting jabbed. And since I'm always nervous about that, that was a good thing. Before we get to COVID, these vaccines are, the flu shots, I mean, are available now at pharmacies everywhere. And you may be thinking, I can't remember the last time I got the flu. And that's exactly by making it a priority this year is so important. One side effect of the pandemic is that we were spared a significant flu season. And we've had our defenses up so long for COVID-19 threat that our bodies may not have the resistance to flu that you'd expect without a flu shot, because frankly, we hadn't been exposed as much over the last couple of years. But we're more active now and around people more, even compared to last fall. So please consider visiting a pharmacy, booking an appointment with your family doctor to get your flu shot. The county will host a few flu clinics in October and November. You can call 311 for more information about flu shots available throughout the county, or set an appointment. But remember, flu shots are widely available right now at pharmacies and doctor offices. And I also got my flu shot this last weekend. So I did one day and the other one the next day. For our COVID update, thankfully, our community level remains low, with less than 150 cases for 100,000 people. But as you probably noted, as you watch this on a regular basis, these numbers haven't moved very much at this point. That is one thing that stayed relatively level, even though it is in the low transmission range. The main thing we want to stress is vaccines and boosters. They've helped us reach the level we're at now. And without those protections, we've seen what happens. Mortality and hospitalization rates are not on the way down like the cases are. And I've been very concerned about this. And that's why, we have a very small number of unvaccinated people in our county, and they're now accounting for the majority of new severe cases we're seeing. If you haven't gotten the booster before, and you've been listening to people talk about booster 1, 2, 3, 4, you can just take this booster. You do not have to make up for lost boosters. I want to be clear about that. If you've only had one booster before, this is still the right booster to take. It's a bivalent booster, meaning that it's effective against both the original Omicron strain for which the boosters were designed, but it's been modified. Sorry about that. It was effective for the original strain of COVID. That's what they were designed for. The new one is also effective against the Omicron variant. And it's right now the only booster shot that's being administered. All the other shots are no longer being administered except for the main shot. And this is, as I understand it, not the main shot. So you have to get one of the others for a main shot. But for a booster, this is the booster that's out there. And we're really encouraging people to do this. It will give you more protection against the Omicron than the previous booster shot will do. So there are lots of reasons to take it, and just being aware of the higher mortality for people who aren't boosted and vaccinated, or the higher number of people winding up in hospitals is very much an effect of not having kept up with your boosters or not having gotten protection at all. So this is definitely the time to do it. Please come in and get your shots. We now have our date set for our next town hall forum on monkeypox, or MPX. It'll be held virtually Monday, October 10th, and the focus is going to be on the Black community this time. Recent data shows that we're seeing a greater percentage of Black men and Hispanic men impacted by the virus. We also recently expanded eligibility for the MPX vaccine, allowing anyone who is a high risk of contracting the disease can now receive the vaccine through the county. And for more on our public health efforts regarding MPX and COVID, I'd like to welcome Sean O'Donnell and Kimberly Townsend to present their reports, and then we're going to open it up for questions. So thank you all very much, and I'm turning over to the rest of the team.
Thank you, Mr. County Executive. To go to our COVID updates, initially, again, to remind our media and our residents that are following along, we are tracking the typing of the variants. There is 2 new variants that have right now minimal impact, but we are tracking them, BF7 and BA2.75. We'll continue to track on that. It's not currently causing a significant number of illnesses, but those are 2 ones that have been identified. When we look at our data within the county on case rates, as we've mentioned before, we track case rates by vaccination status. And you can see in the lower left our case rates by unvaccinated versus vaccinated. And we've noticed over the last week an elevation in case rates with the unvaccinated population. So we are tracking along that. We only have currently 1 significant data point in jump, but this is a smaller number of people within our county who are unvaccinated, but we are concerned that case rate appears to have jumped recently. When we look at hospitalization rates, you can see again on the left, again with the unvaccinated, after coming down for a few weeks, actually over the last month or 2, we've now and saw a jump up in that number. So again, we'll be looking at the data closely over the next week or 2 to see if that continues or if it's an outlier. As our county executive mentioned, one of our concerns is even as the transmission rates do come down a bit,
Okay, I
think we lost. I think we lost Mr. O'Donnell. Mr. O'Donnell is actually in Naples, Florida. Oh, he's back. Okay.
He had muted. Okay.
Okay. Can you hear me?
Yes.
Yeah.
Okay. My apologies. I'm going to attempt to share this again.
That ambulance is my neck of the woods.
One second. It's not showing. Here we go.
So Sean, I can show the slides and you can just talk the slides or however you want to do it in the interest of time. I know you're in a bad space right now, so allow me to show the slides and you can pick up.
Is it coming up again?
No.
Okay, we may need to do that.
Okay.
So again, one of the things that we're concerned about, as we've mentioned last week, is we're continuing to see approximately 1 death per day due to COVID in our county. And so again, these are much more elevated rates than we've seen at other points between spikes. And so this is again why we remain concerned about people getting their booster shots to increase protection. Most of these deaths are happening with individuals who are not up to date on their vaccinations. As you can see here from the right, we've begun to see across the county an elevation in folks coming back out for those booster shots.
I see that, Sean, Mr. O'Donnell, you are muted again. We cannot hear you.
Can you hear me now?
Yes. James,
okay.
it's
I apologize. I'm working off of computer battery here.
So let me
I think,
let me
yeah,
just jump in.
actually,
Go
I was
ahead,
just
Sean.
about the conclusion for COVID. And at this point, I think like to, yeah, so we can go to slide 14 there, turn it over to Ms. Townsend to address the latest figures on monkeypox and our mpox response.
Thank you, Sean. So as of September 26th, you can see we're just at above 25,000 cases of MPX in the United States. And in Maryland, we are at 647 cases, which is up 9 cases since our last conversation. So we continue to see some new cases, which indicates there's still transmission. We'll continue to monitor the situation so that we can provide updates to our community. This is a 7-day average of cases reported to the CDC. You can see moving in towards mid-September, we see a little bit of leveling off, but overall there appears to be a downward trend in new cases of MPX. We'll continue to monitor to see if that continues to be more of a plateau. Although our hopes with all the mitigation strategies region-wide that it will continue to trend down. We have 76 cases identified in Montgomery County as of September 23rd. In collaboration with the Maryland Department of Health, our disease control program continues to do tracing, and we have identified 81 cases of contacts. When we do the tracing, we do reach out to provide and offer vaccination for those that have been exposed. And according to our Maryland data, we've vaccinated just over 2,000 Maryland residents in our county. And you can see to the right there in terms of positive cases by specimen in our county, we also are demonstrating a downward trend of new cases. So here it is notable that there are a few groups that we are going to be reaching out to increase vaccination for MPX, particularly our communities that, for example, our Black and African American communities, where about 30% of our cases are. We are seeing about 20% of this community is coming out for vaccination. So again, we are doing several things to help reach communities that are impacted, such as providing education, reaching out to our community partners, providing vaccinations at our sites, as well as the town hall that's coming up soon that will be helping us communicate with our Black and African American communities about preventing spread of mpox in the community. And of course, we continue to provide vaccination to our priority 1 and 2 groups for post-exposure prophylaxis or prevention. And as mentioned earlier, we have expanded our groups, so we are now providing prevention or preventive vaccination to those that are at highest risk. So we continue to do those. Again, just to remind everyone, we do have enough vaccine to provide for those that are at highest risk, including those that are pre-registered on our site. So we continue to monitor those pre-registration applicants and reach out to people that are currently eligible for the vaccine so that we can continue to vaccinate as many people as we can. And with that, I think I will turn it back over to Lorna.
Thank you very much, Mr. O'Donnell and Ms. Townsend. Dr. Bridgers, is there anything you would like to add? And I know Dr. Stoddard has some comments regarding the efforts of recovery in Puerto Rico.
Sure, thank you, Lorna. Sure, just a couple of quick items as Mr. O'Donnell, and thank Mr. O'Donnell, who's actually in Florida in the actual eye of the hurricane, and so for his willingness to always support our county executive during his briefing and providing the COVID update. As Mr. O'Donnell indicated, we're seeing our data in our 6 hospitals to plateau, but we still need to increase our booster rates, as Mr. County Executive indicated, and so he's charged us with looking at multiple strategies outside of education, media. But if you recall that Dr. Stoddard and I, over a year and a half ago, worked with the University of Maryland and some of the studies that they did on vaccine hesitancy and apathy, and some of the data analysis that they did, we received information this morning that the National Association of City and County Health officials will be releasing funding for in collaboration with the CDC to examine and address and target vaccine hesitancy. So we will be moving forward with that to increase our ability to have more folks boosted with the current bivalent vaccine that's available. So I just wanted to add that point. Thank you, Lauren, and I'll turn it over back to you or to Dr. Stoddard.
Thank you, Dr. Bridges. Dr. Stoddard.
Yeah, just a quick update. Just wanted to provide an update to something the county executive had said. That the FEMA team from Montgomery County Fire Rescue will not be deploying down in South Carolina. They're sort of in a holding pattern, figuring out what additional water resource assets are going to be needed by FEMA. So as you can imagine, with the landfall just occurring now, there's a lot of moving parts to this, and we're trying to work through all the details before we can confirm exactly how or what we'll be doing to support. There are definitely members from Fire Rescue responding to assist Florida through various team efforts. And I know that there are requests that are being processed through the Florida Emergency Management Agency that are coming up to the state of Maryland that we also expect to be able to support, actually going back and forth on those as we speak. So more information later on how we'll be supporting the efforts in Florida, but just wanted to make that update to what the county executive said. So that's all I got.
Thank you, Dr. Stoddard. Members of the media, reporters, this is the time for our Q&As. I do not see any on the chat quite yet, so we'll give it a minute to see if any of you has a question for our officials today. Any questions, members of the media? I'll give you one more second or two. Okay, this is a first. No questions.
Hey,
Going once.
a week without controversy. How can you manage that?
Going twice. I guess we're done for today. Thank you, everybody, for joining us. Thank you, officials, members of the media that participated. And we'll see you again next week. Have a great and safe afternoon.
Thank you all.
Bye, everybody.